Frequently, an elastic shoelace is used at this point too if we are training a patient on how to put it on and off themselves. There is the strap, the Velcro strap, which would go around and attach to the ankle and at the upper part of the calf in order to secure it. And it gives the patient, again, that balance where they could stand and start ambulating, where before they had absolutely no control, and you'd see them stand and the ankle would be rolling and there'd be absolutely no support. It's used routinely in therapy. Shortly, we'll be looking at a lower extremity prosthetic limb. When a patient has undergone the surgical removal of a lower extremity, we refer to this as an above-knee or below-knee amputation. The immediate concerns after surgery, of course, are wound care, ACE bandaging, and the use of a residual limb, or that portion of a patient's leg that's remaining, a shrinker on that area. Once the edema or swelling of the leg has subsided, the doctor will send an order for a prosthetist to be consulted to fabricate a lower extremity prosthetic limb. So let's turn our attention to our above-knee amputee device. It has a harness which helps secure it to the body of a patient. The concern of the caregiver primarily will be in this segment of the prosthetic limb, which is called the socket. I'm going to turn this around and tip it so you can get a look at the hollowness of the inside. And this is the part of the limb that the residual limb is inserted in. What should be kept in mind is that, before we go any further, is that this part of the prosthesis must be kept clean and wiped out every day inside with mild soap and water so that nothing but only the cleanest materials touch the patient. Inside of the limb, before the limb is inserted into the prosthetic leg, there can be several types of application materials. There can be sheaths, which are made out of a nylon type of fabric, which resemble actually the bottom of a pair of nylons, and they can be of different plies or densities. Over that is generally placed a sock, which is more whitish in color generally and is of a cotton nylon blend. So you'll have your sheaths, you'll have your sock, and then the residual limb would be inserted into the prosthetic leg. However, recently I've seen some gel type socks used, and that would be put on the patient's residual limb, and then the limb would be inserted again into the socket. The points that should be remembered here are that all the gel type sheaths, the sheaths themselves, and the sock must be kept very clean. They have to be washed out every night by hand and absolutely be dry before they're put on the patient's skin. Also, the patient's skin must be inspected all the time, especially in the beginning when they're trying to build up a wearing tolerance to the lower extremity prosthesis, because it just doesn't come when the leg comes. Therapy, specifically the physical therapist, is working on the wearing tolerance of the prosthetic leg with the patient, and that can start with as short as a few minutes, building up to 15 minutes, a half hour. Every patient is individual. What the caregiver's concern is to be sure that they're following the guidelines for wearing tolerance and to keep the leg and the materials used on the residual limb and the residual limb itself as clean as possible. If there's even a tiny pinpoint segment of the residual limb that looks as though there's any redness starting, swelling, anything unusual at all, it should be reported immediately to nursing in the therapy department, and the prosthesis should not be put on the patient until all these concerns are reviewed by the appropriate medical personnel, and even the prosthetist will be contacted, and he may come out and see if there's any changes he can make to help rectify any problems. There are some guidelines that follow all orthotics and prosthetics, and I'd like to review those with you. Number 1, the caregiver checks skin condition for irritation prior to applying the device. Number 2, the caregiver examines prosthesis or orthosis for condition and cleanliness. 3, notifies the therapist or nurse when any broken or loose parts are evident, or comments from the client indicates that the fit is not comfortable. Next, allows the client to assist as he's able. Next, asks the client about comfortable positioning of the device. checks for pressure where the device attaches to skin surfaces if it were in contact with the skin, and lastly, handles the device in a way that minimizes damage. I want to thank you for having me here today to discuss supportive and positioning equipment, orthotics, and prostheses. Again, remember, there's a vast array of equipment and devices out there, and for our purposes today, we just focused on some of the more generally commonly used items. But most importantly, I want you to remember the most important rule of all, and that's to treat all of your patients as though they were your own family members. And thank you.